Welcome to Pursuing Quality Long-Term Care, an educational podcast for individuals needing long-term care and their families. Join us as we talk with national experts and advocates about strategies you can use in the pursuit of quality long-term care. This podcast is a program of the National Consumer Voice for Quality Long-Term Care. Consumer Voice is a nonprofit organization and depends on our members and donors for support. To contribute to this podcast and our work, make a donation at theconsumervoice.org/donate. Every dollar helps. Currently, the reconciliation process is underway in Congress. At stake are hundreds of billions of dollars in cuts to Medicaid, which would permanently alter the Medicaid program and have long-lasting and devastating impacts on tens of millions of Americans nationwide. In this episode, Consumer Voice's Public Policy Director Sam Brooks will discuss the reconciliation process with Nicole Jorwic and Gelila Selassie and what it will mean for Medicaid recipients, including nursing home residents and other consumers of long-term care supports and services. Additionally, this episode will include a call to action and lays out what you can do to help stop these catastrophic cuts to this essential healthcare program.
All right. Hello, everybody, and welcome to this podcast. We're really glad to have you here. Today, we're going to be talking about what's going on in Congress right now around reconciliation legislation and the proposed cuts that are likely to be coming to Medicaid that would just have devastating impact on the Medicaid program, all Medicaid recipients, including nursing home residents, recipients of HCBS, and other recipients of long-term supports and services. So we're really fortunate and lucky today to have two experts on the subject to walk us through really where things stand now. This is a fluid process and things are changing constantly, but what we do know is that we need to anticipate the proposal of significant cuts by the Republicans to pay for their agenda, which is predominantly going to be tax cuts that they want to extend to the wealthy. So up first, we have Nicole Jurwic from Caring Across Generations. We're really lucky to have you here, Nicole. Nicole is the Chief Program Officer at Caring Across Generations. Prior to her current roles, Nicole was Senior Director of Public Policy and Senior Executive Officer of State Advocacy at the ARC of the United States. Nicole leads and supports many coalitions to advance the priorities of the care movement, including strengthening and expanding access to home and community-based care and better pay for direct care workers. Nicole is a member of the President's Committee on People with Intellectual and Developmental Disabilities, and she's importantly a sibling to her brother Chris, who is 35 and has autism, a former direct care worker, and she's on a care team for her three grandparents in their 90s. And I'm also going to introduce Gelila Selassie at this time. Gelila is an attorney with Justice and Aging, and she's been there since 2020. Her work focuses on improving equitable access to Medicaid and quality long-term care for lower-income older adults. In addition to working with federal partners, she also works frequently with state and local advocates to improve state Medicaid policy. Gelila received her BA from the University of South Carolina and her JD from Wake Forest University School of Law. After law school, she worked as a legal aid attorney in Charlotte, North Carolina, helping low-income individuals appeal improper terminations and denials of their public benefits. She also spent 2 years as an Equal Justice Works Fellow, where she furthered access to crucial benefits for older adults. And again, we're really lucky to have both Nicole and Gelila on the front lines. Everywhere I go, I see Nicole and Gelila fighting for Medicaid recipients. Nicole, let's start with you and just talk a bit about what's going on. I mean, we're hearing about the reconciliation process. Can you kind of walk us through what that is and where it stands right now?
Sure, definitely. And thank you for that kind introduction, and really happy to be here. Consumer Voice is such an important partner and always has been, no matter where I've been working at any particular time. Right now, the budget reconciliation process has started because there has been an actual budget resolution that has been discussed in both the House and the Senate. If the budget reconciliation process sounds familiar, it's because it's what is often used because in the Senate, it means that there's only needs a simple majority. So because in the last decade plus, or even more than that, obviously, there's been a lot of tight margins in the House and the Senate. Budget reconciliation is how we've seen additions be made to the program, like in the case of the American Rescue Plan Act, and the almost $37 billion that was added into the Medicaid system under the Biden administration was also used through this process. And so really the way that it's different is that what is part of the budget resolution has to have a budgetary impact. And again, also just needs that simple majority. And so right now what's being contemplated, there's one version in the House, one version in the Senate, but in the House just last week, it passed out of committee a bill that included 880 billion with a B, cut to what the Energy and Commerce Committee, which is the committee in the House that oversees Medicaid, would have to cut. That is a huge number, and it means that Medicaid cuts would definitely have to be on the table, which is why we have to continue to talk about it. But the budget resolution process is going to be used in the House and the Senate, and Medicaid is really being looked at again as kind of like a piggy bank to get the money that that President Trump and House and Senate Republicans want for their priorities, which right now is a continuation of the tax cuts that were passed in 2017. So we as advocates for Medicaid beneficiaries have to be really vigilant and say that that cannot be the source of the cuts, because it is tight margins. So we only have to convince some people.
Yeah, and I know that I just even read something, I think it was yesterday on the Hill, that even some Republicans are balking already. And as you said, maybe the purplish district Republicans are balking at the size of the cuts. What would 800 billion do to the if say they did cut 800 billion from the Medicaid program? I mean, it's hard to say exactly what it would do, but would it be the same Medicaid program we've known for decades?
No, I mean, in order to get to a cut as big as over $800 billion, it would have to be, that would have to include structural changes to the Medicaid program, like a block grant or per capita cap. We know we have some idea of what it might do because that's actually a similar cut to what was proposed in 2017. It was anywhere between 700 and 900 billion at that time. And at that time, we were hearing state Medicaid directors talking about having to cut their whole supported employment program funded by Medicaid, or in some cases cutting their whole home and community-based service program altogether, because there's nothing in any of these pieces of legislation that would change what's mandatory, what's optional. So home and community-based services are at extreme risk.
Right.
And so we can't let a cut that big happen. But anything, even if it's 109 billion, which was what the last work requirement that was proposed in 2023 cost, that would ultimately cost the whole program, and there's no state that can make up for that. So whether it's 100 billion via a work requirement or 800 billion via a per capita cap, the program cannot afford it, and no state can make up the difference.
Right. And so there's several ways, and Gelila, I want to bring you in just a second, that they're proposing cuts, like you said, block grants, caps, work requirements. I've seen a number that 92% of Medicaid recipients already work. Is that an accurate number?
Yes, it is. And 92% of Medicaid beneficiaries are already working.
Yeah.
And also the 8% that aren't are either disabled or providing care.
Right.
So Gelila and I both were at a briefing in Congress last week around work requirements, and our colleague Dave Mocklet from NHELP said, we have been saying that work requirements are a solution in search of a problem because of that 92%.
Right,
People are already working, but he said it's really a problem in search of a what did he say, Gelila? A
problem in search of a justification.
There we go.
like that.
Yeah, and so that was a really perfect way to say it. And Gelila can talk more about the direct impacts, but yeah, all of it would be bad.
I mean, it seems somewhat like a cynical ploy just to introduce red tape. I mean, we all know how hard it is for beneficiaries to interact with welfare offices now across the country, and just to get simple things processed, let alone filling out additional forms. Gelila, can you talk a little bit? So we also have heard the term block grants or um, cap or caps, and those are things that I think sound less innocuous than they are. Could you just
Mhm.
walk us through what block granting or caps would mean or
Yeah.
are?
Yeah. As Nicole mentioned, these are things that have been brought about before in efforts in 2017 to repeal Medicaid or change Medicaid in the ACA. And then a couple of times since then have come up. And to be honest, I mean, budget reconciliation is really the really imminent issue now, but it's really important for folks to realize that these things could come up again when the debt ceiling gets reached again. Those negotiations had to come back to these conversations. So it's really important to stay engaged now, but to continue that engagement moving forward. In terms of what these programs are, we hear them reframed as reforms, as flexibilities, as this and that, but they're cuts, plain and simple. Same with work
Right.
requirements. They're just flat out cuts to save money by keeping people enrolled. And the way block grants work is it would give states a grant, basically a large sum of money, and the state would have the discretion to decide how much of those dollars are going to go to each type of service or each type of Medicaid enrollee. And then once they reach that amount, once they've spent that grant that they've been giving, it's done, no more. There's nothing else, and the state would have to come completely out of pocket for anything else that would need to be provided, which states likely can't do and won't do. Per capita caps are similar, except instead of one big sort of block of money, it's a lot of smaller blocks of money for each type of Medicaid enrollee. So people enrolled in like a Medicaid for older adults, for people 65 plus, they get a specific amount of money per enrollee. That amount's going to be different than a child who's on Medicaid under 19. That's going to be a specific amount of money per enrollee. So in that sense, it gives states slightly less discretion, but the impact is the same. It's still intended to be way less than what the actual healthcare costs would be for all of those populations. It's intended to be a cut to cut the federal contributions to states. It's especially per capita caps are especially harmful for older adults and people with disabilities because they have the highest health needs and their needs are changing. So the caps and the block grants can account for these population specific changes over time. And so they're not really reforms or any other euphemism. They're pretty much just a cut to end the entitlement so that, states are on the hook to really just cut enrollment or cut services once that funding stream is drastically changed.
And it sounds like, and one thing that we talk about is that they could make eligibility requirements stricter, who can get services, what services, when we talk about home and community-based services, which allow people to stay at home, could lead to higher institutionalization of individuals, which we of course are against. And it's just and one other thing that I pointed out, and this was true I think in the last time in 2016, is they also give states flexibility of what rules they need to comply with. So for instance, you have the Nursing Home Reform Act, which really provides significant rights and to residents. And as part of the flexibilities, some of those regulations could be waived, those rules could be waived. So you're going to see an accompanying kind of decrease or degradation of care. Nicole, coming back to you, I've also heard that there's discussion, and I don't know how true this is, of the FMAP, of the federal matching being reduced. Is that something that's on the table? And federal match, for folks listening, is the idea, I think, Gelila, I got this from you the other day, that, the federal government pays roughly or on about 50% of Medicaid. For some state, it's much higher. But Nicole, is that on the table, reducing how much that the federal government would pay towards Medicaid?
Yeah, so on average, Medicaid does pay about 50%, but in some states it's up to 70%. And what that means, and that's also part of what would change with a block grant or per capita cap, is that Medicaid guarantee that any state right now knows that they're gonna pay $1 into Medicaid and it's gonna be matched at that rate. There is talk about cutting the FMAP, but that can also look like a lot of different ways, as Galila said. Like, this is going to keep coming back, and it can keep coming back looking in different forms. As an example, through the Affordable Care Act, there's a higher FMAP, 90% FMAP for Medicaid expansion enrollees, which do include a lot of family caregivers and disabled
Right.
people and aging adults. And there's definitely has been talk of cutting that very large federal FMAP, but then also could be that there's other attempts to cut the current federal side of Medicaid funding, and that would be incredibly difficult. I've said when I was talking before about states not being able to make up the difference, many people don't realize that Medicaid funds make up about a third of all state budgets in terms of the money that's coming in. And so that being cut, states are going to be able to make that up for those Medicaid services, and it could also impact other things that states are spending money on. So the FMAP, the threats against FMAP, which also really are part of the per capita cap and block grant threats, are all real and something that we have to be paying attention to, because if anything, what we've seen is that states need the extra money. That American Rescue Plan Act funding that I talked about was 10%, a 10% increase in that FMAP, and all 50 states, red and blue, took it up. So there's not states that need less. Every state
Right.
needs more.
Right. I mean, we think about the consequences of something like this are just, it's almost incomprehensible, because we're talking about not only cuts to individual care, but you're going to be talking about cuts to the workforce, people who provide care, cuts to home and community base. So you're talking about more workers who are going to not have jobs, and this is just going to have devastating consequences on a lot of communities where a lot of them rely on healthcare for jobs, and I don't think people. I think we do, and but I don't think even some Republicans realize how devastating this will be. I mean, the irony is many their districts rely heavily on Medicaid, as we all know, and the consequences of this will be just devastating.
Yeah, but
Gelila, sorry, go ahead,
sorry, I
please.
was just gonna say, but that's actually been the good thing, and that's why everybody does need to stay engaged.
Yeah,
Because when we have that data of each district in the House and each state for the senators, how many people are receiving Medicaid and what percentage of those are people with disabilities, what percentage of those
right,
are aging adults, and how many of those are direct care workers, which Medicaid pays 70% of direct care worker wages. So any cut would definitely impact those groups, and it's working.
right,
That's why you are seeing articles about Medicaid slowing, and the Medicaid cuts in particular, slowing things down. And that's
right.
why we have to keep it up. So just to say, like, that's why we have to be loud and consistent,
Yeah.
because these threats are going to consistently come up, but they're also consistently not popular. And so we just have to keep reminding folks of that.
That's absolutely right. And what we've been talking about, these are cuts. There may be fancy words like block grants and caps, but these are cuts no matter what it is. These are cuts to Medicaid. Galil, I want to talk a little bit about older folks and how they rely on Medicaid. We did a one pager on nursing homes, and in LTSS, Medicaid pays for over half of all LTSS in the country. And we're an aging country that's getting older each year, as we know. Um, about, I think, 5 out of 8 nursing home residents rely on Medicaid. But could you talk a little bit more about how Medicaid supports other older Americans that, say, aren't in nursing homes or aren't even receiving HCBS, and how important it is to them?
Yeah, I mean, overall, Medicaid is such a unique and wonderful healthcare program because it is so broad. As you mentioned, lots of people get coverage like LTSS and many other things that Medicare just won't cover. And so that's really important. There's over 10 million older adults and people with disabilities who are duly enrolled in Medicare and Medicaid. So very often there's the narrative that politicians say that we have to protect Medicare for our seniors, but Medicaid is also needs to be said with that same breath, because that's what many of them rely on. Like LTSS is a big one. There's a few other optional services that states can provide through Medicaid waivers, like dental and vision and hearing, that Medicare doesn't always offer. And then the other big one is just assistance with their Medicare costs. So a lot of those dually enrolled people are very low income, very limited assets. They have the highest needs. And so as wonderful as Medicare is, they would not be able to afford the premiums and the deductibles. And that's where Medicaid comes in through the Medicare Savings Program, MSPs, that's administered through state Medicaid agencies. So it's a limited Medicaid program, but it covers a lot of the
Right.
premiums and out-of-pocket costs for low-income seniors, where, again, they just cannot use their Medicare benefits. So if Medicaid gets cut in any way, whether it's through these huge systematic changes or something a little bit smaller, it's going to affect the ability for low-income seniors to get Medicare. And then that's why we've been saying that any cuts to Medicaid is a cut to Medicare for these millions and millions of dual eligibles.
Right. It's catastrophic.
Mhm.
So what else, Nicole and Gelila, before we talk about what folks could be doing, what else do they need to be needs to be known about this? I mean, what kind of timeline are we on? Do you think I mean, what are the Republicans who are, obviously running the show now because of majorities in both houses of Congress? What are they looking to time-wise, or what are they shooting for?
Sure. I mean, so just in reality, it changes every 15 minutes, it seems like. So like by the time we're talking right now, by
Right.
the time this airs, but just to say that right now there's two different bills. There's a bill in the Senate, there's a bill in the House.
Hmm.
Neither of those are the same, so that's going to cause confusion. There's one President Trump and the Speaker of the House, Mike Johnson, wants to do one big bill that includes all of these different things. The Senate wants to do two. So just naming all of the different variables that are going to mean that all of these timelines can be different. And as Gelila mentioned, there's also the debt ceiling that comes into play. And so right now there is a bill that in out of the House that passed out of the budget committee. And that's the one that includes the really big high cuts that would inevitably hit the Medicaid program. Um, that's the one we have to stop right this second. And so that's the where the focus needs to be. And they probably will try to do it quickly, because what you'll see is that they tend to try to do things quickly so that people don't have a chance to really look and see what's in the bills.
Right.
So that's why, you have to be keeping up with folks like Consumer Voice and other orgs so that you know kind of what is next. But ultimately, all you have to know is that any like was just said, anything that's no matter what it said, flexibility, whatever, all of that here cuts.
Yeah.
And so that's we just have to be consistent in that message.
Did you want to add anything to that, Kalila?
No, I think Nicole said it much more eloquently than I could. It's like, things change minute by minute, and I don't even know if Congress knows what its own timeline is between the two chambers. So it is very confusing. But to Nicole's point, what really matters is people knowing that these are cuts and just sharing their stories and the impact that Medicaid has on their lives is what's really crucial. And to just keep up that messaging throughout, because there's just going to be a lot of fights up ahead.
And how should they be doing that? I mean, how can they share their stories? Should they be talking to? I mean, people want to fight this. I know they do. But I think they feel a little bit overwhelmed. What should they be doing, Nicole or Galila, to either of you?
Yeah, well, I mean, first of all, it can be really overwhelming, and we obviously just talked about some wonkier things like
Yeah.
percentage caps, and you don't have to be an expert on any of those things.
Right.
All you have to be as an expert in is an expert of your own story, and also to understand all the things that Medicaid covers in your state. Medicaid is complicated because it's called different things in every state because it is a state and federal partnership. And so you don't have to even be an expert on that, but you do have to know if a service that your family member is getting where it's funded. And I'm going to tell you, probably a lot of the times it's Medicaid, even if it's
Right.
called Badger Care or 10 Care or
Right.
anything else. And so that's what you have to know. And then you have to reach out to the people who represent you. So your member of the House, your senators, and tell them that they need to protect Medicaid. And it doesn't matter if they're a Democrat or a Republican, they need to hear, because everybody needs to hear about the popularity of the program so that it's not something, whether it's now in negotiations or in 6 months in negotiations, it has to seem toxic to even touch it. And that's going to happen by people sharing their stories.
Yeah, I agree. It's really important to remember, as difficult as times are now, there is a very thin margin in the House and not, only a few seat majority in the Senate. So every vote really does matter and every constituency really does matter to try to move that needle. In addition to everything that Nicole said, just sharing stories, nobody needs to be policy wonks. We're meeting with members, staffers all the time. And we provide a lot of the data and the policy arguments, and they always ask, okay, what does this mean for my constituents? So that is really, really what they want to hear. Just individual stories. It doesn't have to be a law review article explaining the importance of Medicaid or anything. And then echoing Nicole's points about what this means for the local person, their healthy living wager, their Palmetto Care, whatever it's called. That's really important to be aware of, that's what's at risk. And then just for advocates who are already doing a lot of work to improve or expand Medicaid, keep that up. Like, you obviously have to keep an eye out for the cuts and reach out to members and talk to state officials if you can, make sure they're putting state Medicaid directors and folks in governor's offices and state legislators are putting that pressure on federal officials, because they're the ones who are going to get the blame too if they have to make those hard choices of which one of their constituents can't get health care, right? So keeping engaged with state partners as well is really important. And then just anything folks are doing. Some states are still trying to raise or even eliminate the Medicaid asset limit, for example. So seniors don't have to spend down every dime they have just to get basic care. Continue doing those efforts. We want to protect Medicaid and continue to strengthen it. So everyone should just keep doing what they're doing in terms of protecting Medicaid. Don't let our foot come off the gas, keep representing the communities you care about the best way that you can, and then just make sure you're elevating just how important Medicaid is for your population.
That's great. And you can come to the consumervoice.org and easily there's a page on there that you can find out exactly who is your representative and who is your senator. And it doesn't matter where you live, in a blue state or a red state, they need to be hearing from you. Blue states, generally, representatives are going to be supportive of preserving Medicaid, but they need to hear from you. They need to hear their stories so they can share those stories with people who are in red states across the aisle. And it does work. I think a lot of people think the system is broken, and it may be in some ways, but it does work. We are hearing that it does move people in the middle. There are a lot of purplish states, and don't take for granted. And even if you know what your benefits are, make sure your neighbor knows, and make sure that their neighbor knows that this would be a cataclysmic life change, really country changing. I can't think of a better term, cataclysmic event for all Americans, and would just have devastating health effects for decades to come. And I'm grateful to you both for being here. Did you want to give your guys' website or any resources that folks might need? I want to be able to give you, because I know both of you are putting stuff out, and I'm happy to direct people there as well.
Yeah, I mean, all of our social media channels are at Caring Across Gen, like GEN for generations, and that's the same as our website, our website is caringacross.org, and you can check out our weekly Medicaid Minute videos and other ways to stay involved and to keep the pressure on the folks representing us.
Yeah, our website, justiceandaging.org. We have a lot of materials there. We also do a lot with access to housing and economic security and elder rights, and on top of all the healthcare and Medicaid protection work that we're doing now. And we also have a alert tab for folks who want to get our regular newsletters and emails, as well as just any really urgent calls to actions. Folks can sign up for that through our website.
Great. And again, really an honor to have you both here. I know that you're working really nonstop to preserve Medicaid, and you're an inspiration to us. And I use both of your work a lot in the work I do. So I'm really grateful for you taking the time to come and talk today. And thanks to all of you. Please keep a lookout for more information on our website. We're going to be also making opportunities available to you where you can come and send a message, like do an action alert directly to your members of Congress. But this is a critical time. We can't wait. The fight is now. It's not it's not time to wait until a full bill comes out. We need to fight now. And again, Nicole, Gelila, thank you so much for being here, and we're grateful. And thanks to all of you for tuning in.
Thank you so much,
Thank
Sam.
you. Appreciate it.
Thanks for joining us on Pursuing Quality Long-Term Care. This podcast is a program of the National Consumer Voice for Quality Long-Term Care. Consumer Voice is a nonprofit organization and depends on our members and donors for support. To contribute to this podcast and our work, make a donation at theconsumervoice.org/donate. Every dollar helps. And make sure to visit our website, theconsumervoice.org/pursuingquality, where you can subscribe to the podcast, follow us on social media, and find more information and resources. If you enjoy the podcast, please rate, review, and subscribe. Thanks for listening, and we'll see you next episode.